From the beginning of time, the greatest risk from a wound was not the wound itself, but instead the infection that followed. Because of this, even minor wounds that today would merit a few stitches and a lollipop were instead a death sentence to our ancestors. Before the advent of modern antiseptics, surgeries were so risky that physicians would have to use all of their persuasive powers to convince patients that a surgery was worthwhile. Procedures that are now considered simple, such as the removal of a hemorrhoid, would have warranted great debate on the necessity versus the risk. The risk associated with being cut into, even within the highly limited scope of ancient surgery, was too great to take lightly without modern antiseptics and antibiotics. However, there was one other way to prevent infection beyond avoidance of injury: sterilizing objects before use. This begins the history of sterilization of medical instruments. Far before the advent of germ theory, people had an understanding of infection when it came to wounds. For example, in 550 BCE, Greek infantry soldiers would fight naked at times, as shown in the image, because they had figured out that when clothing fibers came in contact with a wound after being stabbed, the wound was more likely to be infected. This phenomenon shows that to these soldiers, the increased risk of being wounded while fighting without clothes was far better than an increased risk of infection from those wounds. One of the first times that sterility is seen applied to the medical field is with the works of Aelius Galenus, colloquially known as Galen of Pergamon. Galen served as a physician for a gladiator school, and during that time he became very well versed in the treatment of wounds. It is believed that he popularized the use of heat in the form of boiling waters to disinfect surgical instruments, and the instruments shown in Figure 3 are made of bronze, which is heat resistant and allowed this method to be used without damage on the objects. This practice became very popular throughout the Roman Empire and involved boiling any instruments before usage and in between patients. This method doesn't lead to actual sterilization, but it comes about as close as classical physicians could get and does effectively disinfect the tools to reduce the rate of infection. Throughout the Middle Ages and Renaissance, medicine in the European world did not advance much, so when it comes to the story of sterilization, the next important moment comes after jumping forward almost two millennia with the work of Florence Nightingale. She wrote, "The nurse must ever be on watch, ever on her guard against the want of cleanliness, foul air, want of light, and of warmth." Nightingale was a believer in the miasma theory of disease, which believed that disease was spread by bad smells in the air. This led to attempts of preventing the spread of disease by removing bad smells and bringing in fresh air. This was not a correct understanding of how diseases spread, but her beliefs meant that the soldiers of the Crimean War were no longer in close contact with the least sterile thing possible while healing from wounds: human feces. She revolutionized the world of nursing, and one of the largest changes she made was the washing of hands in between patients. Figure 5 was a diagram made by her that showed a breakdown of deaths by month and by cause. The large blue wedges represented mitigatable diseases and made up most of the graph, showing the need for change in cleanliness in the nursing field. While she did not have a complete understanding of sterility and the spread of disease, her work was revolutionary in increasing cleanliness within the medical profession, an important step towards the use of sterile objects. Around this time period, Louis Pasteur had begun doing research on how different diseases were caused by germs and also discovered that heat could kill pathogens. This knowledge opened up the world to the idea of sterilization, and germ theory overall revolutionized the way people thought about the world around them and kickstarted a true understanding of that which people as far back as ancient Greece had figured out: a clean wound is a safe wound. Finally, with germ theory came the ability to define what is sterile. When an instrument is sterile, it is free from all living microorganisms, and therefore should not have a single living thing on it. This is a high standard to uphold, and for instances when a 100% microorganism-free environment was unnecessary, a new distinction was made: disinfection. For cases such as surgeries or piercings, sterilization is necessary, but for more superficial procedures, disinfection can be enough. The concept and use of sterility developed further throughout the 1900s, allowing more and more complex medical procedures to be performed with an acceptable survival and infection rates. Surgeons began to develop new procedures, such as scrubbing in before surgery, to create and maintain an entire sterile field, and the infection risk plummeted. The change in understanding from a time when soldiers fought naked to protect from wounds to when the first surgeon properly scrubbed up for surgery feels like a huge change, but the basic understanding is practically the same: a dirty wound will cause infection. This idea is most perfectly applied with the use of sterile instruments and application of a sterile field around surgical incisions. Um, but in the end, this Lebanese proverb sums it up the best. And it truly shows that the idea is as old as time. A clean wound is a safe wound.